Hi everybody, it's lovely to see so many of you here this morning. I've been a midwife for 27 years now and a nurse prior to that as well, and I've worked in all areas of midwifery, some of what Sue's already described, and I've held different leadership and management posts. But today I wanted to talk to you about breaking down walls and the challenges of leadership in my current role as head of midwifery. So sometimes it's too easy, I think, to get caught up in this process, and if you allow yourself to get immersed into the culture, sometimes you end up getting into a cycle of fear, litigation, record keeping, and perpetuating that cycle and not being able to see out of it. So I feel it's necessary sometimes to just stop and review your priorities and just stand back and look at what you're doing. The things for me that are really important are listening to women, make sure that you use systems that support communications and don't hinder, which a lot of us we're caught up in, systems that don't talk to each other and things like that. Excuse me a minute. The other issue is financial constraints. A lot of the time that can lead to poor staffing and resources, but actually if we spend some money on those and sort them out, it can result in better quality care, less complaints and reduced claims, and in the end it's actually cheaper, and those are the kind of things that we need to keep on and keep chipping away at. And also, I think we need to focus on quality, safety, women's and their families' experiences of our service and make sure our service is based around those, definitely. These are some, you can't read it very well, I was trying to get everything on it, so it's quite small writing, so I will go through it. But there's descriptions of qualities of leaders and managers, so on the left-hand side, there's leaders, and on the right-hand side, it's managers. So for a leader, there's a leader innovates, a manager administers. A leader is an original, a manager is a copy. A leader develops, a manager maintains. A leader focuses on people, a manager focuses on systems and structures. A leader inspires trust, and a manager relies on control. A leader has long-range perspective and a manager has a short-range view. A leader asks why and what, and a manager asks how and when. And a leader has their eye on the horizon, and a manager has their eye on the bottom line. A leader originates and a manager imitates. A leader challenges the status quo, and a manager accepts the status quo. A leader is his or her own person, and a manager is a classic good soldier. And a leader does the right thing, and a manager does things right. So, how many of you know a manager in the audience today? I'm sure all of you. And how many know a leader out of all of those? Okay, slightly less. But what's really important is you don't have to be a manager to be a leader. Anybody can be a leader. It can be a cleaner, it can be support worker, student, midwife, anybody. But it's recognising those qualities and skills within your workforce and nurturing and developing those skills that is really, really important. And also encouraging people to be leaders and to innovate and help support them to do that. These are the 5 leadership practices that I think are really important, and I hope that I demonstrate myself. So the first one for me is critical, which is model the way and being a role model to your staff and having credibility, so leaders' credibility. And one of the challenges with that is that leaders must be relatable to the team in order to work with the team. And the second one is inspiring a shared vision, and the goal has to benefit everyone, not just you as a leader. And the challenge for that is that people have to be willing to buy into that and be part of the solution and actually have worked on the goal with you, so you've done it as a collective and worked on it together. The third one is challenge the process. which is about risk-taking and experimenting. And I think lots of people are very fearful to do that currently, especially in the NHS, which we work in at the moment. And there aren't any known solutions, and the challenges of that are making sure that you do experiment so that it's part of the solution. The fourth one is about enabling others to act, about teamwork. So it's about working together and all having the same values and vision to take your service forward. But that does require collective wisdom and to come together and making issues more complex than they actually are, and breaking it down and trying to do it in the quickest and easiest way possible, but together as a team. And the last one that is really important is about encouraging the heart, about motivation. And the only problem with that is that you do have to deal with constant setbacks every day. I'm sure a lot of you are firefighting a lot of the time and not able to develop your vision to move your service forward, which is sometimes a challenge. So I like to think that our organisation and myself as a leader are well on our way with these things, but they've taken time to develop, and it does take time. But leadership should be inclusive, and there should be understanding of the needs of your staff and the community that you work within as well. But a good organisation should show adaptability, a diverse talent pipeline, innovation, engagement, should always be enabling, and show consistency as well. The problem for me, one of the issues, is that working in a DGH can be difficult, and sometimes maternity feels like you're fitting a square peg in a round hole. I don't know if anybody else feels like that sometimes, but it can be quite difficult. So the system is generally built for general nursing, and too often the system has to try to fit maternity into it, which doesn't always work. I work in a clinical business unit which has children's and women's, so we're very specialised. Paediatrics is exactly the same, and neonates. They're all very specialised areas, and we all have to try to fit into this one box, which can be quite difficult. Gynae as well, our gynae ward tends to have a lot of outliers, so they're dealing not just with gynae patients but surgical, medical, orthopaedic patients due to the demand on bed capacity currently. So it's how we move their service forward so they work in a way that is beneficial to the women that are supposed to be there for gynae procedures. Each of the areas has their own special training, and they're all individual. So like with the gynae wards, you can move your staff around and things. We can't do that within our areas because our paediatric nurses can't work in maternity and vice versa and that sort of thing. So it isn't as easy as the rest of the hospital. And very often it feels like you're in your own special habitat, and we just work together as like a little mini hospital sometimes. And that work sometimes isn't recognised as well within the whole organisation in some places. So you end up doing everything that fits with the general side as well as maternity specific, and as we know lately there's a lot more emphasis on maternity services. So we've got increased focus such as Each Baby Counts, the Improvement Fund for Safety, the CNST 10 steps have just come into practice, and there's a new investigation branch that's formed, and the Better Birth Transformation. There's all of these things that are enough on their own without having the other stuff on top of it as well. So adaptation of systems is really important to do, and that's something that I have struggled with, but we're really getting there within our organisation at the moment, trying to make things work for maternity that do fit and work properly. But you often feel like that, don't you? Patting your head and rubbing your tummy at the same time, trying to do two different systems and work with two different things at the same time and fit it all in together, which can be really difficult. So one thing that I've always said throughout my career is that you can challenge and try as hard as you might, but unless you're enabled within the organisation, you won't be able to break down those walls. So I really feel that I am being enabled by my organisation. We've got a trust board that's listening. They did a listening event with the CBUs, and we said that the structure of the organisation didn't work for us. So they've actually changed that structure, and it's really working well for us. I've got a lot more access to the trust board, and I really like that. It's really good. Our chief nurse is leading on maternity at board level, and we have a really good relationship, and she's really fighting to make sure maternity is there at board level. We've got a maternity health improvement committee which has been set up as well, which our chief nurse chairs. And, you know, all those things that you want to move on, but you can't because the rest of the organisation doesn't recognise maternity. Well, because she's the chair and she's part of our committee, we're actually getting things done. She's actually making those things move and making those things happen, which is brilliant. So supporting changes necessary to move the service forward is really important, and that comes from being enabled. And also the recognition that maternity doesn't always fit into the general box. That's the key, really. As well as that, there's a national maternity transformation. So in my area, we're part of the Cheshire and Merseyside transformation team, and we're part of a vanguard and an early adopter site for a lot of the things as well. So it's been great having that, because that actually supports what I'm trying to do within the organisation. So I use that very much to influence what we're trying to do in the trust. So we're looking at having a freestanding midwifery-led unit as long as our alongside midwifery-led unit, looking at models to support continuity of carer, and I'm working with Birth Rate Plus at the moment within our organisation to sort that out, hopefully. But what we want as well is to support healthy women and babies in midwifery-led settings, but support women and babies everywhere. But the early adopters are helping us with developing freestanding midwifery units, which should help that. And then that supports women choose at the service that they want as well, with the work that we're doing there, which is great. So I thought I'd just go through things, what I've got in my toolbox. So it's all right going in there with your big wrecking ball to break down those walls, but sometimes that doesn't work as well as using your little chipping hammer. So that's what's in my toolkit. That's my main tool, is a chipping hammer. So I just keep chipping away until eventually we get there and break down those walls with that. The next thing that I've got in my toolkit is external peer support. So I know that what is really important is a quality service which is woman-centred, and keep the focus within that. And these people really help me focus, and also sense check as well. So if I'm concerned about something or worried about something, I can often sense check with people, and know that they've got the same vision as well within their perspectives, which is great. And I've put a picture of lovely Mary in the corner there, because she's iconic to me, which is amazing. And then the other thing in my toolkit is courage, and that's why I encourage everybody within the team to have is courage. And you don't have to be in there fighting the corner every day, but you just have to know that if it doesn't work first time, you try again. So if you don't do it today, you'll do it tomorrow, but you just keep going at it and chipping away. And then the other person in my toolbox is my consultant midwife. Me and my consultant midwife are like that. You can't get a credit card between us. She works for the same aims and the same values as myself, but we work in different ways. So we can get things done much quicker by working in that way. And we're a strong team, which is great. And then the other people in my organisation that form part of that team that are our strength as well is our chief nurse Kimberly has been super supportive, and here we had a little girl who wanted to be a midwife. It was her dream, so we made her a midwife for the day, so our chief nurse helped with that as well. And our obstetricians are great. There's a picture there with Rita, who's our labour ward lead. And she's got exactly the same values as myself and Louise, working together for what women want and women's decision making, and that they're centre of everything. And also safety for babies as well. And then at the bottom, we've got the matrons who do the operational stuff. But again, they're part of the team that are influencing our values and making our service strong and developing it, which is great. And then I've got a fantastic clinical director and work really well with him, and our commissioner as well. They're really important people as well to have around you in your toolkit. But the most important people at the end of the day, the superstar midwives that I work with. It's really important to identify people that have got courage and that will take things the extra mile and superstars. So really nurture those kind of people and develop them. They're our future, and we really need really strong midwives to take us forward into the next generation, and I'm hopeful that they will be those people. Oh, Mary Jo's going to kill me for putting this picture up. She doesn't know I've got it on my slides, but we did lithotomy challenge. So taking women's perspective into account is really important, and walking in their shoes is really important. So I'm sure you've all seen hashtag MatExp on social media, but from Jill Phillips. So we did Who's Shoes with service users, our volunteers, obstetricians, midwives, our neonatal staff, commissioners, everybody, all around the table, and the transformation team from Cheshire and Mersey as well were involved. And we did a Who's Shoes event, so we walked in each other's shoes, and we made the big poster, as you do, to put all of the issues down, and we're working on those issues to resolve them and make our service better. But we also do lithotomy challenge now and again, just so the staff know how it feels for women to be in lithotomy. And we always write down how it felt and why we're doing it, and perhaps we should stop doing it. And we do that with the doctors and the obstetricians as well. I'm not going to go into this into detail because Mary will be coming on to this, but evidence-based services are really important, and that's one of the focuses as well, woman-centred evidence-based care. And the Lancet qualitative framework puts all that into perspective really, and shows you how you should be delivering your service, but Mary will talk about it later. But also use your nice guidelines and things like that to really use to change and shape your service. It's really important. Our service should be evidence-based, not based on opinion, but based on evidence. And these are the 5 key things that I think are really important to be a good leader. We've gone into them in a bit more detail before, but modelling the way is the first one, inspiring a shared vision, challenging the process, enabling others to act, and encouraging the heart. And changing the culture isn't always easy. It can be really difficult, but you will get there. But you need to create a good state of mind in the environment that you're working in. So smile often, think positively, give thanks a lot, laugh and love others and dream big. And make sure that you use things outside to get your relief as well from work. So use your friends and your family. And Billy Hunter did that lovely work about restorative parts of our work that we do, and found that dogs were a key stress release for midwives. So if you haven't got a dog, think about it. It might really help. And then other things that would really help would be having a chief midwife at national level, And I would love to be on our trust board as a director of midwifery, and I think all organisations should have directors of midwifery. And a recognition that midwifery doesn't fit into a nursing model, and maternity care follows a woman's whole journey, not just a location or part of a journey. And we really have to get out of this putting women in a box, in a place. And the main thing that I wanted to say as well is that change will not come if we wait for some other person or some other time. We are the ones we've been waiting for. We are the change that we seek. And you're all leaders and you're all able to make change, and you really need to go out there and do it. So pick your head up and just go for it and do it. So thank you.
Take a few questions. Okay. We have got a few minutes for questions, and somewhere there's our roving mic. Yes, there it is. There she is. Does anyone have any questions for Tracey? I'd like to know where she gets her little chipping hammer. That's a nice idea. Is there a question over here? This lady on the edge.
Good morning. I'm Veronica Morgan. I'm from, what are we now? University of Birmingham Hospital, Maternity Services. Everything has changed because of the merger within Birmingham. One of the things that you've mentioned, which I'm very much interested in, you mentioned about being enabled.
Yeah.
You also mentioned about being able to get in there and make changes. Mm-hmm. As a head of midwifery, which is one of my biggest frustration, is that we're being managed by nurses. Now, I do go to the trust board. Our nurse hasn't got a clue about midwifery services. So I fail to support nursing trying to give advice at that level about maternity services. I would have thought that all the head of midwifery should be fighting for a midwife to be leading for maternity services at that level. It is very frustrating. I'm there and putting my hand up, what about maternity? And I think that is where we need to start. Because whatever we do in the clinical area, we have still got to fulfill our better births and all the other bits that you've mentioned. But until we get the support at that level with some clarity, because they try and introduce policies and guidelines that doesn't really apply to normality within maternity services. So for me, it's about hearing the head of midwifery going there and champion and says, we want to be a director of midwifery, we want a place on the board. Thank you.
I agree, and that's what we should be campaigning for, is directors of midwifery on the board. But that will have to come from national level, but it would be really helpful if we had a chief midwife nationally as well, and I think that's key. So until we've got those, I don't think we will see all directors of midwifery on board, but there are some places where there are, and those are the people that we should be taking the lead from as well. And learning about how effective that they are, and getting them to write stuff, which is really important, so they can share it with us. But yes, it is an issue, and I have worked hard to get a really good relationship with my chief nurse, and talk to her about the issues, and I think she has got there now. But you know, I've had my little chipping hammer out, and she will say that, but I don't let it lie, I just keep chipping away with her. So,
yeah. So doing a bit of mentoring then.
Yeah.
Okay, that's great. Thank you. Okay. Any other questions? Okay, well, thank you very much, Tracey. Did you want to take your water? Yeah.